Welcome back. This is Dr. Cash. This is Dr. Cash Medical and Life. Today we'll be talking about a topic that I encounter quite often in the hospital setting, and that is Clostridium Difficile colitis, also known as short C. diff. This is a common infection that we encounter quite often, and let me just share with you to give you some relevance in real life situation. Not too long ago, I was taking care of an elderly gentleman who came from home because he was weak and frail. He felt at home, was a little bit confused, so he was brought into the hospital, and we did some workup. We found that he was dehydrated and appeared to have suffered from a UTI, urinary tract infection. So he was having low-grade fever as well when he first came in. So we went ahead and treat him with antibiotics. And after about 3 days in the hospital, he felt better. He's able to eat a little bit more, but still quite deconditioned and weak. And so we went ahead and sent him to skilled nursing home for rehab. Additionally, we also sent him out on 2 more days worth of antibiotics for him to complete his treatment for the UTI. So he went there for about just a few days, 3 or 4 days, and he had to come right back in because he was having profuse diarrhea, not feeling well, dehydrated again. And so the staff at the skilled nursing home had to send him back to the hospital again. And so we went ahead and admit him to the hospital and did a workup, of which we were suspicious because of the diarrhea. The diarrhea was profuse. He was having a little bit of abdominal cramping, but it was pretty profuse, heavy, running back and forth to the bathroom several times within hours. And so we certainly knew something was definitely wrong. And some of the things that came up to be on top of our differential or a possibility of the illness, certainly Clostridium Difficile colitis is highly suspicious, but other things to consider could include Campylobacter, viral gastroenteritis, medications, Giardia, although in this situation it's unlikely. And so we did some workup, and sure enough, the stool studies came positive for Clostridium Difficile colitis. And so we went ahead and then start him on treatment. In this situation, we put him on fidaxomicin, which will be a 10-day course of antibiotics specifically for this particular type of infection. So after a few days, he feels much better and the diarrhea stopped. And so we went ahead and sent him back into the rehab again with 8 more days worth of the deficit or fidaxomicin. And he will finish that, and I hope that that will completely cure him so that he doesn't have to return to the hospital. Now, in considering this particular type of infection, he has a mild case of C. diff. I would say mild to moderate. In severe cases, people can actually get very sick with bowel obstruction, sepsis, can go into septic shock, and despite maximum effort, some people will die. And so this is a serious and complicated problems and conditions to treat. But fortunately for our gentleman, he recovered well and he responded well, and he went back to rehab, and I hope that he will continue to do well. Now, C. diff is a common condition that as we use more and more antibiotics in the hospital type of setting, or even on the outpatient setting, more people will become infected with C. diff as the normal flora of their guts are being altered, and then C. diff can grow and cause problem with colitis. And people can have mild symptoms such as diarrhea, only, or and a little bit of abdominal cramping, to as severe as full-blown bowel obstruction, bowel necrosis, and that would require ICU stay and even bowel resection. So it can be a very serious diagnosis that people can die from. Okay, so in the future, just in case if your doctor say, hey, you know what, you may have this little infection, but you may not require antibiotics, they have good reason for it. And they're fearful that a high frequency use of antibiotics can cause problem and alter the flora of the gut and can cause C. diff to or Clostridium difficile to flourish and cause problems. So if your doctor make a recommendation not to be antibiotics, they have good reason behind that. Okay. So I hope that today you learned something about C. diff in this brief description of our patient. And if you have any questions, concern, suggestions, please put in the comment section below. And I will see you next time. Have a good one. And thank you so much for watching. And please subscribe if you have not already. Have a good day.